Hi, my name is Chanel Jones. I work for the Toledo Lucas County Health Department. I'm also a member of the Getting to One Coalition.
Hi, I'm Gloria Smith, a public health nurse with the Toledo Lucas County Health Department.
Hello, my name is Timila Manander. I'm a registered nurse of Nepal and currently working as a graduate assistant in Toledo Lucas County Health Department for infant vitality. Pre-eclampsia, it is a pregnancy disorder.
Pre-eclampsia can cause organ damage, stroke, premature birth, seizures, and even death. Pre-eclampsia can occur during birth and during the postpartum period, which is up to 6 weeks after giving birth.
Any pregnant women can get pre-eclampsia. However, there are some women who are in greater risk of pre-eclampsia than others. Some of the risk factors include first pregnancy. If a woman is pregnant for the first time, she is at risk of having pre-eclampsia. If the pregnant women have had history of pre-eclampsia with her previous pregnancies, as well as if she has had any family member such as her mother or sister who had pre-eclampsia, then she's again at risk of pre-eclampsia. If the pregnancy occurs before the age of 20 or after the age of 40, then that woman is at risk for pre-eclampsia. Similarly, pregnancy using in vitro fertilization and pregnancy with more than one baby, a woman with chronic hypertension or diabetes mellitus type 1 or 2 or any kind of renal diseases are at risk of preeclampsia.
High blood pressure is one of the most common symptoms of preeclampsia. We judge high blood pressure to be 140/90. When you're having your blood pressure checked with your provider, make sure that you ask them what those numbers are as opposed to just accepting, oh, it's okay. There are different normals for different women, so make sure that you take note of that so you can make a comparison on your own.
Another symptom would be sudden gain in weight and puffiness and swelling of face or hand, and even having difficulty to breathe, vision problems such as blurry vision, double vision, or even the loss of vision.
Another sign of preeclampsia would be headaches. Some women have complained of severe headaches. Some women have complained of just a mild headache. So make sure that you report those incidents of any types of headaches to your provider. Another symptom or sign of preeclampsia would be abdominal pain. And you want to make sure that you report every episode of nausea and vomiting with your physician. Another sign of preeclampsia would be protein in your urine. Protein in your urine is not something that you can identify on your own. But when you go in for your prenatal appointments, they will always do a urine specimen. On conclusion of the urine specimens, you always want to make sure that you ask them, what was the level of protein in my urine? Don't just allow them to say it's okay. They need to actually respond to the level of protein that's in your urine.
Do not forget to follow up with your doctor if you feel any abnormality in your body, because no one can understand your body more than yourself. During this COVID-19 pandemic, what I would like to suggest to you is that if you have signs and symptoms of preeclampsia, do not hesitate to go to hospital and seek medical treatment.
The most important thing is to keep all of your prenatal appointments and make sure that all of your complaints are being heard and listened to.
Make sure they address your needs and your symptoms. Hopefully, with the information you learned, You'll share it with others and also apply it if you're pregnant.